Dr. Tricia Thompson. How you doing?
I'm good, Karen. How are you today?
I'm really good, thanks. Thank you for saying yes to this. I hear you talking about so many things. I hear you jumping in to help everyone when they need it. And I wanted to have a conversation with you to give other people who maybe don't know you as well as I do to have the opportunity to hear how awesome you are and how real and open and honest and transparent and like really trailblazing the way in that gap between the medical model and real everyday life and what root causes of disease are. So I'm so excited to have this chat with you. So let's open it all up.
All right. It's
Why don't you
open.
start?
Open the
Let,
door.
let's crack that door open. Look, I suppose why don't you tell us a little bit about, where you started and what got you to where you are now?
Yeah. So, I started in osteopathy in the United States. So, I chose to go to an osteopathic school. I went to Nova Southeastern. I went to Nova Southeastern in Fort Lauderdale, Florida. And why I chose the osteopathic route is because I felt more holistic than the traditional allopathic route. So, in the United States, both osteopaths and allopaths are licensed the same way. We're all practiced medicine the same way. We all train the same way. But the osteopathic kind of holistic philosophy always resonated with me. And then I picked emergency medicine because it was fun and it was exciting and I was really good at it. And I really enjoyed it for a long time. I worked in level one trauma centers and took care of all, thousands and thousands and thousands of patients. And somewhere in the kind of mid-career, so maybe 12 years in, I started to really just see this changing trend of people not coming to the ER for an emergency. They were coming to the ER for chronic exacerbations of chronic conditions. So whether that was, diabetes or arthritis or a lot of autoimmune diseases like lupus or MS or Crohn's disease, all of those things started coming and they were a majority of what I was doing. It changed from me really doing acute care, heart attacks and strokes and traumas to all of this. How do I help these people when their doctors are just telling them, they've had 7 CAT scans of their belly for their belly pain. Like me turning them into a zombie with more radiation isn't really the solution. So what could I start to offer them? And that's really when I started looking at integrative and functional medicine. And I thought about that and researched it for, gosh, I don't know, 7 years before I took the leap. Just because I couldn't visualize the transition from what I had been doing for all of these years into this completely different way of not just practicing, but looking at medicine. I mean, and we can go into how we're trained and why it is the way it is, and pharmaceuticals and big ag and all the government stuff. Um, but for me, it really just felt like I wasn't in alignment with who I was helping at the time. So,
Yeah. Like it's fascinating. First of all, it's fascinating that you say that, the ER is fun and exciting. I'm like, oh my God, that must have been so scary. So like it takes a special type of person to be able to do that and to, manage all types of things and people and situations and traumas as well as the chronic things coming in as well. It's so great to hear, that you had an interest, you had a desire to, you waited a while and then you did the training. What was it like though, leaving what you were doing and jumping into a whole other side and like what is it about it that makes you, I suppose, fun and excited now?
yeah, well, I think it's a couple things. So I did a 2-year fellowship with Andrew Weil at the University of Arizona in integrative medicine. And that first night, we all arrived in the same room. There were 100 doctors, mostly a few nurse practitioners with advanced training. And I finally felt like I was at home. I finally felt like I was in a community of people that got what we were doing as a conventional medical model wasn't working anymore. And whether it was their own personal journey, which a lot of us have, or it was, that they just saw people failing and failing and failing, and another drug they knew wasn't going to solve the problem. So that was like coming home to me, that first week of fellowship where we were all together and kind of learning the same things and just hearing why all of these other people were making that same decision. So that was really fun and exciting to feel like I had found my people, if you will. And then, how does this light me up now? It lights me up because I watch my clients improve so fast when they were stuck for so long and actually declining. They were going downhill and they could watch themselves month by month or year by year. And they kept looking back going, God, I killed to be where I was 4 years ago. And now they're on 4 more medications and they've earned themselves another label or two. And just being able to give those people hope that there is a better way or a different way or something they haven't looked at. And a lot of people don't even know what integrative and functional medicine is. Like, this is really a new specialty. And, the way the medical system changes, it's, 10, 15 years before this becomes close to mainstream for lots of reasons, if it ever gets there, because there's a lot of pressure for us not to succeed, because if we take people and we make them healthy, take them out of the current system, they lose their, it's not all revenue, but there's a lot of incentives there.
There is a big model to keep people sick. That's where a
Yes.
lot of money is made, unfortunately. I know I'm a
Mm-hmm.
little bit biased, but I have come through that system.
Excuse
Um,
me,
Bless you.
I have an
Why
itch.
don't you tell us integrative functional medicine for anybody that doesn't know, because you've obviously had experience in both sides of the coin. Why don't you tell us what is it and how is it different to the medical model?
So I think the traditional medical model, and this is how I was trained, this is how all doctors in the United States are trained. Patient comes with a complaint, you look and you take a history, you do a physical exam, you get some lab data if possible, or imaging, and then you give them a diagnosis, or what I call a label. So now they've gotten slapped with this label, and the way we were trained was, if you have this label, you treat it with this pharmaceutical or this drug. It wasn't that we never were taught, well, make sure they're sleeping or get them out to exercise or make sure they're eating right. Not that we learned what that was in medical school. I did a lot of additional training on my own in what eating right means. So the difference is that when you come to me with all of these symptoms, so this is really what it is. I don't care what the label is. I don't care what somebody's calling it, because a lot of times, quite frankly, it's not the right label. And then we just dive into the symptoms and then the systems. So we're all just one big system. We're not the heart system and the brain system and the GI system. Like, it's all connected. And what we've lost in conventional medicine is that connection. I was listening to a conversation with a physician the other day, and she was saying, we've been incentivized to micro specialize. She was talking to a guy who was a nerve ear doctor. So he was an ENT, but only dealt with the nerves of the ear. That's all he does all day long. So when you see a nerve ear problem, you don't think to ask, how's this person's gut? Are they inflamed? Do they have pain other places? Are they having other neurological symptoms? Because we've gotten so subspecialized, we can't look at it. So for me, it's really about the systems model and how each piece of the system is contributing at the same time. So you can't split it up. You can't just have one little piece and have that find you a solution, a real solution.
Ah, that it's really inspiring to hear that, and it's also really frightening because most people will, and we've all been trained like that. You get sick, you go to the doctor gives you whatever they give you, you go home, you just hope that it works. But I really do see that it's missing seeing the entire picture, which is kind of scary, right? Because it's treating one little tiny piece of the puzzle.
Well, and then Karen, the other thing that I think is really important, and not everybody dives into this, is when I see a client or one of my coaches sees a client for the first time, we go back to before you were born. We talk about what was happening to mom and dad when you were in utero. We talk about, ear infections you had as a kid, or the, trauma you had on the baseball field when you got hit with a bat, or where you lived, places you've traveled, work you've done, stressors you've been under, because all of those things come into your system and we can't ignore them. So it's not just, do you drink? How much do you smoke? How many drugs did you do? Like, that's good information, but that's really the history, the social history we were taught to take as, medical students and residents. It wasn't about where did you live, and oh, you grew up next to a power plant, or your mom had all of these autoimmune diseases, and how did that impact your life? So I think that's a big piece of it too. It's really diving into that true history and not just, okay, so when did this thing start with you? Because all of this thing started a year ago, 5 years ago, 10 years ago, or longer.
Amazing. I keep wanting to like go into the next one. I'm like, I have so many more questions about what you just said. Um, by the way, for those people that are watching, there are going to be more, so stay tuned. And I'm going to ask one more question before we do move on to the next one. Talk to me a little bit about what if somebody had got lots of family history, or maybe doesn't know their family history, or maybe is scared because like there's so much stuff there and they're maybe afraid to uncover it. In terms of the type of treatment that you do, is there a possibility that people might be a little bit afraid to think, I'm not going to be able, or it's going to be too much, or I might not remember, whatever it might be? Talk to us a little bit about that.
Yeah, so Karen, I heard two different questions in there. And the first
There was
one,
probably about four, actually.
well, I'm going to focus on the two that I heard, and then you can pick me up whatever I forgot. So first one is, what if we've got this big family history? And this happens a lot, half the family has a cancer, or half the family has Alzheimer's, and or mom and dad all had strokes and heart attacks, and I don't want to go down that road. I think today is the perfect time to dive into that. Because if we're going to prevent, which really should be the mission of medicine, education and prevention, if we're going to keep you from, even if you're halfway there. So let's say, mom and dad all have heart disease, and you're 35, you already get diagnosed with high cholesterol, blood pressure's running borderline, you gain some weight, and you're on that pre-metabolic path. Your sugar's running a little bit high sometimes. So you're there. So if I give you 5 more years, you're going to earn every one of those labels: diabetes, high cholesterol, high blood pressure, hypertension. If we stop this now, you're not only not going to earn that label, but you're going to actually be so much healthier than you would have been otherwise. And we know that all of these diseases are environmental, and what we're doing with our bodies. And it's not just you eat junk food or you drink too many beers or you smoke too many cigarettes. It's not just that. It's that our environment is toxic, and our environment is, stuff that exists in our world today didn't even exist 100 years ago. So we look at the elevated rates of autism, for example, which is now up to like 41 in 1,000 kids. This is a disease that did not exist 100 years ago. And every year, the numbers are going higher and higher. Why is that? Because kids' bodies changed? No, bodies haven't changed. It's our environment that's changed. So going back to, if you've got all of those things in your family history, I look at it as just more information, right? Like, can I do a test that identifies some of the issues, whether that's the gut microbiome, or inflammation testing, or toxin testing, or hormone testing, or just taking that great history. Can I identify what these things are now so that we have the information we need to go forward to turn on the right genes and turn off the other genes? So we know with epigenetics, we can do that. It's just about giving the body the right message. So now I've forgotten your other question.
No, that's okay. I'll give you the other question. Great that you remember that one. It's a great answer. So if someone then maybe is afraid to face all of those things, because there might have been trauma, or it could be trauma for the person that you're dealing with. It might be a trauma that maybe they're afraid to go and ask those things. What if somebody and then the second part of that is, what if somebody doesn't know?
Yeah, well, if you don't know, you don't know. We're going to go with
Mm.
what we have. We can dig in, we can go through your health timeline, your history, and I can learn a lot. There's always testing we can do if we're curious about something or something is really like a deal. Like we got to know the answer to this.
Yeah.
There's not a test alive we can't get our hands on. So that part's easy. Now, if you're just afraid, my question really is, are you afraid to be well? Are you afraid to get to a point where like this is no longer an issue for you? And I was talking with a client the other day who was telling me she was so fearful because her doctors had ordered, she was at the rheumatologist and the gastroenterologist and the cardiologist and the neurologist, and they all ordered all these tests. And when she came to work with me, she's like, but what am I going to do when something comes back? I'm like, it's just more information. It's just for more for me to use to help you. Now, I already had a big suspicion of what her underlying cause was, and it was a toxin exposure to mold. And it happened not recently, but like 15 years ago. And she's been on this downward spiral since then. And she was terrified. She's like, I know they're going to tell me I have rheumatoid arthritis, but I know in my gut that's not it. And she was like, I'm really afraid to get these test results back. I'm like, it's all good. Like, it's just more information. I think when we're afraid because either we don't know what we're going to do next, right? So you get
Mm.
slapped with a label, and whether that's an unexpected diagnosis like a cancer or something else, and you don't know what the future holds. And when you're working with me, like I'm going to hold that for you. I'm going to carry that weight. And we're going to do the things we can do to mitigate what's there. And maybe there's some things we can't fix all the way. I mean, there could be. And that's okay too. But how far can we go? How good can we get you?
Amazing. Amazing. Well, look, we're going to jump into the next part of this in just a moment, but thank you so much for those really inspiring and eye-opening answers. It feels safe to know, and it feels comforting to know that somebody that has your medical experience and background and then is diving into it from the other side as well. It feels like a whole 360 approach, and that feels really lovely indeed. So thank you for your work. We'll see you in the next part.
You're welcome. Thank you.